So, many people, they think that, for you to achieve what we call good health, you need to have a special doctor beside you. There's nothing wrong with that. But the most important thing is that you yourself as an individual, you should be your own doctor. And that's what actually we are teaching the nation or the people to say that be your own doctor in the first place. Because it's you yourself who know where you sleep, the type of the plates that you use when you are putting, you are serving your meals, maybe even the type of a house you are sleeping in, or you know everything about you yourself. So if you can't for sure understand the principles involved for gathering this wonderful system, which is your system, which is your body, then you are doomed.
Catch Victoria's Health Diaries every Sunday at 19 hours.
Having the right general information about your health will help you make informed decisions about your health and your lifestyle. Welcome to Victoria's Health Diaries, and I'm Victoria. Of course, we are having yet another time to just share a basic health information that's going to help you build on what we already established last week. And of course, I have the pleasure and the honor of hosting yet another episode with Dr. Hamalilo Mwila. He's a medical consultant at Balm of Gilead Health Center, who is also working in conjunction with NAJIC International Japan. He is specialized in naturopathic medicine, chiropractic therapy, and plant pharmacology. Welcome, Doc, and it's a pleasure having you today.
Thank you very much. I'm also privileged to be on this platform again.
Well, thank you so much for making time yet again to just share your vast experience and knowledge so that, as a people, we can tap into what you know and make it information that can help us. I know, Doc, you are not a man who has been in this industry for a short while. You have vast experience. You have seen people. You have been in and out of different generations. Okay, maybe I can call it generations.
Oh, yeah.
You have seen. You have walked through this medical field in a very long time. So last week we had an interesting conversation. And we were trying to define health because, of course, this is Victoria's Health Diaries, and we want to maybe lay a proper base on what health is. And I think we achieved that last week. But, of course, we're building on to where we left it off. So just in case there's someone tuning in today and they did not follow through where we started from, of course, they'll need to watch our first video, and would like you to also make sure you hit that subscribe button and follow the previous video so that you get to follow through what we had last week with Dr. Hamalilo. It's going to help you. Okay, so Doc, we were trying to define health, and you went into the diverse angles of health. We looked at the definitions of health based on the dictionary, simply the dictionary, in the medical terms as well.
Dictionary.
Yes.
Well. Yes. Yes.
And of course, the most interesting one.
Yeah.
Is the one that we stayed on in our last episode. So maybe just give us a little bit of a recap on that.
Thank you, Madam Victoria. It's very interesting, just like the way you have alluded in the first place, that is a basic. So we are talking about basic health. And this is the area where we have completely, lost. Yeah, we have lost it. Because we think that health is, something which is extremely big.
Yeah.
And you have to start it from that big angle for you to understand that maybe you need to go, for 7 solid years for you to understand health. And other people, they don't even bother because they say, well, there are other people who are trained in that field, so they will help us. I'm talking about the medical doctors, who are employed by the nation, the government, through these institutions. We have got private institutions also. We have got doctors there. So, many people, they think that, for you to achieve what we call good health, you need to have a special doctor beside you. You know, I'm also citing the way it happened to my elder sister, who had a special doctor, which is not wrong, of course, to have, you know, a doctor which we call a family doctor.
Yeah.
There's nothing wrong with that. But you know, the most important thing is that you yourself as an individual, you should be your own doctor.
Of course.
And that's what actually we are teaching the nation or the people, to say that be your own doctor in the first place. Because it's you yourself who know where you sleep, the type of the plates that you use when you are putting, you know, you are serving your meals, maybe even the type of a house you are sleeping in, or you know everything about you yourself. So if you can't for sure understand the principles involved for governing this wonderful system, which is your system, which is your body, then you are doomed. And this is what is happening today, because we have entrusted, you know, our bodies in other hands, you know, other people. It's hands. We are talking about the doctors, which is not wrong. But we are saying, like the way we said earlier in the first episode, we're saying the most important thing is to understand the basic, and that basic principles on health of living. It's very, very important. We mentioned, of course, here and there on when we are trying to define the word health, you know, picking from different definitions, maybe from the English basic English dictionary there, which says about the good condition of body and mind, and from the medical dictionary point of view, they are talking about when all the parts of the body are functioning optimally well. And then we came to the one which we rested upon, and which we want to run with it. We are talking about the naturopathic, in the naturopathic realm. We are talking about the preservation, how to preserve the life forces and the keeping of this delicate mechanism of the body in order. So when we are talking about the delicate mechanism, we are talking about the human body comprises of different systems. We are talking about the, you know, the organs like the eye system. We are talking about the brain system. We are talking about the lung system, the kidneys, you know, the digestive system. Talk about the lymphatic system. What about the blood system? And talk about even the nerve system. Yes, the airwaves, so the nerves where electrical impulse passes through. You know, let's talk about the stream, the vessels, which is the blood vessels. That's the system on its own.
Now, the way you're coming out, Doc, you see, this is maybe why we don't really want to get into health, because it feels a bit complex. The human body is a bit complicated.
Yes.
So how does someone just, how do we get to understand that? We've seen that when someone is studying to be a doctor, they spend so many years.
Yes, exactly.
More than maybe other careers, other professions. You spend a lot of years just studying the human body, studying the function of the body.
Well, being in the system for long, I think that has been for sure a very big problem, because I could see it also that it's quite very difficult, you know, for a common person, a lay person, you know, to drive or maybe to dive into this so-called health subject because of the complex that it holds there.
Exactly.
But in nutshell, what we are saying, when we are saying basic, it also depends on the way the information is given out there. Yes. For example, why people, they don't have even interest, like in the past, it's only now where they have tried to simplify. But in the past, it was quite difficult to come even on radio or platform or TV. You talk about health. Why? It's because of the words.
The terminologies.
Yes.
Every time you're told the terminology, you don't even know what it is, you're afraid.
You know, I'm trying to explain to my, you know, or just put this information on air, and someone is listening to Kwakaputa, Nangubare, Kwashangombo, or maybe in a southern province, Papamonze, you know, Choma, Livingstone, a central province. You know, these are my old people. You know, I'm there as a doctor on the platform. I want to give out the information. And then I'm mentioning about mitochondria. ribosome reticulum. How the mama there in the village, or my papa, or maybe my grandfather, going to have the interest to listen to the subject.
Exactly. It's something we just brush off.
Yes.
Something sometimes would react to something we don't understand by just brushing it off.
You don't. Immediately when you start listening, there's this health segment which is being aired, then you change the wave, or you move from that section to go to another section.
Exactly.
You know, something which you
can easily understand.
Yeah.
And
so now,
assimilate.
what are we trying to say? We are trying to say that it has been difficult for sure, but I thank God that today things are now getting simple.
Exactly.
And people that are now following and they see for sure that no, I think there is a need for me as an individual to put that effort how to keep my body and to keep it, of course, in order, like the way we have said that the delicate mechanism. We are talking about the eyes are very, very delicate.
Of course.
Talk about the teeth,
agree
very
to
delicate.
that.
Yes, you talk about the, the muscles, talk about the bones. Because if you have, calcification problem, where the bones are wearing out, you are losing the calcium, which is supposed to build for you to have a strong bones. And because of not knowing how to keep the bones in the healthier state, then you start developing osteoporosis. Okay,
Sometimes
where the bones,
yeah.
where the bones that become brittle. I know those are the terminology you are talking about when you talk about osteoporosis. So, mama there, I can't actually listen to say, no, but finish Now, we are talking about the bones become soft.
Okay.
Calcium okay, it is not building up. So it's wearing out. And we'll talk maybe as we go. Why wearing out? The calcium, why ire fuma? Nangu ire chepa kuma bones.
Exactly.
So ama bones ya tampo kulaba soft, ire better than that brutal.
Okay.
So it's easier for you to break your bones. Any hour, any minute, the hip. Now we can ureya fye pampando kuya mkwikala at all dislocation. Nishi chinachitika bwanja tawe sure. Ninaye kuchoka chabe pampando pa nambela chabe a pain. And when I went for the X-ray, they find that no, there was a blockage. But what happened?
So no, I just got up.
Yes. So those are some of the things that we are saying. If we are going to make this subject to become so simple, then for sure, many people will be saved.
Okay.
Because the most important thing is that, is to know. For example, preservation of the life forces. Number, if you're twingeisha, ukuchinchinta nanguku keeping ama life forces, which we are talking about maybe defense mechanism ya body ya muntu, we talked about in the previous topic. So, bushe kuchita shan. How can we make our immune system to become strong enough that we are protected from all these ailments? We are talking about infectious and maybe even non-communicable.
Exactly.
Because even that, it has got a certain impact which people they don't know concerning the non-communicable. It's all to do with the system which has broken down. I'm talking about the immune system in this, the defense mechanism of the system, which is very wide.
Yeah.
Talk about the drainage system in the body. Okay, the lymphatic system in the body. Meaning that if you eliminate poisons.
And so now when you say it like that, I think it makes easier. It makes sense because when you say the lymphatic
the drainage system.
When you say it as the drainage, you're like, oh, so even in biology, if I knew that it was the drainage, I think it was going to be easier for me to even understand.
Because look at the system of drainage. So where to go anywhere. If there was this Bombay thing, which the Americans, I'm sure, during the time of Millennium Challenge Fund, which they helped us, of course, to build that drainage to make sure that all this water is passing through smoothly. Instead of having too much more drainages, then that will cause a very strong blockage. Okay?
Yeah. So
now, when there's that, the pathways of these drainages is not going, so that these waters are supposed to be directed to going where? Mwembeshi it joins Kafue. Kafue then it goes into that big river, the Zambezi, and then it goes into the ocean. So that's the system we are talking about. Okay. Now, if these are blocked, the drainages are blocked, what will happen? Okay? So the dirty stuff, because it's not moving, And the water, when it is stagnant, is very smelly and it's very dirty, and it breeds a lot of bacteria. Yeah, including it becomes a breeding ground for these what we call mosquitoes. Okay, so now you'll have a lot of illnesses around. Okay, diarrhea, shani, dysentery, typhoid. There are a lot of diseases which will come from the dirty. Yes, dirty environment. So now, when we are talking about drainage, it's the same thing with the human system.
Same concept, yes.
Okay, so in this body, the drainage system is blocked. Then automatically, there will be what we call reabsorption.
Okay.
Now, reabsorption of the dirty stuff. Let me just cite an example of a blocked colon.
Okay.
Or just an example of it's a system. So that people could have that idea to say, finish if you believe for your colanda papakanshi. So no, but to that blocked colon.
Colon. Simple term.
Okay, the simple term we are going to say that ngamamona system ya which we call alimental canal or digestive system. From the mouth. In the master design, bali panga chipipe. Icho from the mouth, icho chipipe na chi panshi. Icho chipipe icho chafika panshi pa chapange chintu kwati nchigumburi. That's the stomach.
Chinchi?
Gumburi. Yes, gumburi, the stomach.
Okay.
Yeah.
So
no, there's a stomach there. So the pipe, it comes from the mouth, it goes down, and then there's a special design. Okay, but each design kwati nchigumburi. Okay, and my mama will be able to understand. Chigumburi. So, ni container.
Okay.
That's the stomach.
Better, yes.
Yes. So now that container, when it comes out from the container again, there's a connection of a pipe, which is a continuation from the mouth. Itumbo nomba. Iyo nomba ya zigzag, utoturea tuitumbo tunono turia, which they call the small intestines, connected to the big pipe. Which number is almost about 2 inches in diameter when you talk about the colon. Okay. The large colon is 2 inches in diameter, meaning that ubukuru. Number aba monapo ama pipe 2 inches ikuru hiyo. So now,
and it's inside.
Yes, right inside there. So now we are talking about the colon. Iyo yaingira itumbo inono yaingira muri katumbo aka nono kalya kaingira muri ichikaramba cha large colon nomba. Icho chaya ni ascending chile pamuru. Then it is a transverse. So from transverse there it goes to descending colon. Yaisa panch. Then from there it makes kakona paria erectum nomba. Yaisa niku ano. That is the anus.
Okay.
Okay? Which we call the offloading valve. Offloading section. Okay. So now, if this colon has been blocked, so why that wachira randa pwede ama drainage. Ngayaba blocked, what will happen? Meaning that the sewer system, which is blocked, definitely it will cause a very terrible havoc. Why? Because the level of purification, which we call fermentation, yalaba too high. Because there must be, every good hours, there must be elimination of this waste which has built into this colon, or which has been flushed into this colon.
Every hour.
So a period, maybe two periods in a day.
Okay.
Elimination. Okay. So I'm talking about the movement of the waste, the fecal matter, up to the offloading there.
Bowel movement.
The bowel movement, yes. Peristaltic action of the intestine. If a chenda chilia nomba kwati chinsoka firefu mafire. Now, if that has been blocked, munandua ama principles ya tuma basic tuliranda potuma basic principles on healthy living. Eto twachita ignore. Ya iba blocked. Ere bachita overstay. Then it will purify. Number purification iya decay okusasa. Number filia fisasire filia. Mulandu utrat, you know the way God has made in his wisdom the colon yaliba polus. Abantu tabaishiwa yaliba polus. So nga twalanda ti polus, we are talking about ama holes. Yalikuwa tefi punda. So tuma small holes. So meaning that the waters, because that is semi-liquid stuff which is in the colon. Okay? Now, because it's it's in the water form, then it will start sipping.
Porridge.
It will start sipping. Sipping meaning that it will start draining. Iyo fiala tampokula fuma. If in fisasire from the colon, then what will happen to this SASAD stuff, which is decayed stuff, is going to be reabsorbed. It goes where? Into the bloodstream.
Ooh.
That is how the contaminants we are talking about in the bloodstream, yaba number system, iyo send the number through the blood system, iyo your blood quiz. It's the same contaminated blood which will go to the eyes, same blood contaminated which will go to the brain.
Wow.
Same blood which is contaminated to go at lower extremities, which is the legs.
Okay.
The same blood it will go to the kidneys. The same blood it will go to the liver. The same blood it will go to all the organs in the body.
Wow.
Then what will happen with that kind of a person? Atampa nomba elingi lya tularanda kutampa nomba kula chitama complaints area kula lwala.
But doc, first, I think twala wekera kuri example yo. Naluva no kuluvana sanga example ya wama. Okay, so I think we'll get into those details very shortly, but maybe there's someone listening right now.
Yes.
I introduced you as, you know, having all these specialization. Yeah. Maybe someone would want to somehow understand, okay, this man is telling us all of this information. What's the source of his wisdom? Okay, who is he? Where is he coming from? What does he do? How does he know? How do we certify what he's saying?
Oh, well, very interesting.
Yeah.
I would say maybe a little bit my background, where I started my medical diving. I would say way back, to me it's a calling, of course.
Okay.
Yeah, because I used, when we are praying around as kids, you know, during the time they were using me as an ambulance.
What do you mean, though? What were you doing?
I was calling, you know, sick people, taking them to the hospital. You know, so ambulance. So to me, actually, I could see that that's really a calling.
Okay.
It's not just something where I said, you know, maybe from the school point of view, then I said, well, okay, I want to enter into this career. No. But I had
not if you.
No, not in that field. So I started when I went to school. You know, still I was seeing myself building up, you know, into these science subjects.
Okay.
And going to the secondary school, of course, I think in biology I was doing very better. Very, very good. Until during the time, of course, the best inspiration by then, I was already coming from the secondary school in the 1980s area there.
That's a long time ago.
Yeah, that's a long time for sure. There was in our village a certain organization, NGO, which was having a lot of people from different countries.
Okay.
You know, volunteers. They used to call them volunteers at that time. So there was this Dr. Dakhuizen from Netherlands. Okay, he was too close to our village, and this is the man who I associated much with, and is the one actually who was grooming me in this plant pharmacology thing, because he really understood about the plants, you know, and some of the things was doing the so-called tinctures, where he was extracting some active ingredients from certain plants. He could tell me about, this is willow, okay, this is alfalfa, this is the basil, this is you know, sage. You know, there were a lot of things that they were growing, and they were making these medicines out of it. And those were the plants which they had a botanical garden, you know, at that institution. Yes, in Central Province.
Okay.
So that's Dr. Dakhuizen. So from there, you know, I started, and of course, you told me that you have got a passion in this field. So it's better for you to stick to this. than to do football, because I was very good in football. So I wanted to get football as my career.
I didn't know that part of you.
So I was very, very good actually.
Okay.
I scored one of the best football. I was doing number 4.
Maybe that's why we didn't win that game that time.
Yeah.
We were missing the best player in the team.
Midfield number 4. Yeah, by then, those way back. And well, fine enough, I would say quickly, that's how I was introduced to South Africa, where I went to do this chiropractic and plant pharmacology. Yeah, that's in South Africa. And then we stayed there for some time, and doing a lot of things, of course. And then finally, that's when we thought of coming back during the time of Mwanawasa. And then we formulated an institution called Zambia Institute of Natural Medicine and Research. Wow. Yes. Okay. And meaning that I'm proud to say I'm one of the founder of that institution, which is, of course, running in conjunction with the Zambian government and the Ministry of Health.
Wow.
Yes. Yeah, so
that's
research,
something interesting there.
Yeah, so what we wanted at that time, we wanted to come up with our own institution, which is actually formulating the medicines in the African way and in the Zambian way. Okay. Yes, we have got a lot of species which, like I said earlier, that this Dakhaizren, he was actually showing us that, did you know, I came to learn about Mukula through him. Okay. Yeah. The Mukula tree we talk about. Yeah, he was making a very powerful blood booster out of it. Yes. The Mukula tree? Yes. Okay. Now, those are area eaters, and it's none today, which we haven't, of course, even explored. No, we haven't. As a Zambian country, we haven't even gone because we don't have that research. But it happened right here in this country. It's going. You have been hearing about Mukula going outside the country. And our friends there who know the value of these plants, they are actually making powerful things out of it. No, I mean, at the time that he talked about it, yes, it was happening right here in this country. Yeah, of course it was happening. That was on the private part. Okay. Yeah, he was just showing me, certain things which are very valuable in our vicinity. That when someone is having a pernicious anemia, where we are talking about the loss of blood, how do you build the blood of this person? So instead of maybe trying to do the blood transfusion, then that's how he said, do you know that there's this plant in a botanical language, of course, there's a way they mention it, and then Mukula tree, of course, which is known as Mukula. So this is the way we extract the active ingredient out of it, and then you make a very powerful liquid, which has got a very powerful potent. Yes, all we know is that it's a money maker. Yeah. But we didn't know that component. No, I personally didn't know. That's a medicinal plant. Okay. Yes. So in short, that's what we were supposed to do today, that advancing in our research in terms of coming up with our own medicines. I think that's the direction we should be heading to. Yeah. And because I have done a little bit of allopathic. Allopathic is where you are going now dive into the drug system. Okay. Yes. And the formulation of drugs and all those kind of a thing. And why our colleagues there, he was emphasizing that, you see, when you look at the human system, the way it is made, it is compatible to the nature. Yeah, of course. Yeah, very compatible to the nature. So meaning that man came from the soil, if you could get it in there. And from the soil, what do we get? That's where we get all the essential elements, talking about zinc, molybdenum, copper, and all those things which are in the human system. And in his wisdom, God, he has to design that this man, instead of taking direct the soil then smartly, because we are specially created as a created creatures, we are so special. In short, we are saying man is the crowning act of God's creation, compared to the animals. Because the animals, I don't know the way he was actually formulating, but going biblically, saying that let's make man in our own image. So proud to hear that also, that we are made in the image of God. So now, when we are saying God, he formulated us as a crowning act, meaning that among all created things under the sun, we are the best. Of course. In creation. So instead of going back to the soil like the way
animals, in soccer,
now as he created something like plants. Now these plants, they are helping to get the essential elements from the soil. And these are the minerals and vitamins.
Okay.
So meaning that from banana, from orange, from pineapple, from you know, guavas, from apples, from all these, you know, if you are talking about the vegetables, from calembra, from chihuahua, from cassava, from all these, all these, you know, amanuts, you talk about bambara nuts, cashew nuts, groundnuts, you know, there are a lot of varieties in the field of, I mean, in the line of nuts.
Yeah.
Okay, so we are talking about vegetables, fruits, carbohydrates. We are talking about wheat, grains. Those falls under grains, grains. So now, all these, the human body is supposed to get smartly from these plants, okay, for our bodies to continue functioning well.
So us trying to understand the fact that the life cycle is interconnected.
Yes. These are married.
Okay.
So you cannot affect the other one, then you remain the same. If you destroy this, the same thing like we are talking about the global warming. It's because we affected the nature. And the nature which we have affected now, we have to pay.
We have
consequences.
consequences.
Yes, these are the consequences that we are now overheat, you know, where we are talking about my heat waves, they are just hitting us. So in short, these are the basics which we are trying to show to the public, to say that health is not the way we look at it. Health is not in the hospital.
Okay.
It's not in the clinic. Health, it is in your hand, where you are.
Yeah.
So understand the principles that govern the human system.
Sure. So in us trying to know a little bit more about Doc, apart from you being an ambulance, from how you got to discover your calling and to where you are now, how has been your journey in this field? Do you think you have seen more progress then from the time you started up until now? How adaptable or how easily are we accepting this?
Well, we would say it has not been easier. Of course, it has not been easier. We have been pushing, and that's why we are saying proudly that today we have got an institution which is working in conjunction with the Ministry of Health, that is Zambia Institute of Natural Medicine and Research. Okay?
Yes.
So it has not been easier. And not only that, of course, we have gone to champion this program, like what currently we are doing on lifestyle recondition program, where we are going around the country. So of course, it's not only in Zambia. I've gone, worked in Namibia, Botswana, you know, Zimbabwe. Those good days, Zimbabwe. Let's talk about our friends here, even in Kenya. There we interacted very much with our Kenya researchers there, and then Tanzania, Angola. During the time when they were just getting independence there, they're privileged to be invited by, this is the minister, by that time he was a minister of Home Affairs, Kavanaki. Yes, I'm sure he's still alive. He called us to go and help him to set up a lifestyle center there.
Wow, that's
that is in Angola.
impressive.
That's in Angola.
That
So
is
you know, you
amazing.
can see that the impact so far we'll say very good, but it's not enough. Yeah, I still feel it's not enough, and that's why we are trying to engage even the government, that let's see how we can collaborate, because currently, as you said, that I'm working with Energetic International, Japan. There's a special program that we are introducing, or which we introduced in the Zambia, working in conjunction with Balm of Gilead Health Center. Yeah, we robbed this technology of producing a special water, which is ionized water. It is coming actually in the program as we go on.
Yeah, sure, of course. I look forward to that one actually, because it's very interesting.
It's very interesting. That's why you find our colleagues in Japan. Why under the sun actually, you just take a survey or a research.
Sure.
You're going to find that the long-living people under the sun, these are Japanese.
They have the highest centenarians.
Exactly. 150, they go up to 140, 130 hundreds. To them, when you are talking about 80 years old, ooh, those are still young
youth.
people. Those are the people who are actually running in the factory. And I think the challenge last time when we were sharing some ideas with our colleagues in Japan, they were telling us that the challenge we are facing as a government is how to keep these old people. Because these old people, they are not dying. Yes. They are not dying. Why? It's because of yes. So now the government, it has to to support.
Yeah, of course.
There's, what do they call that old age support fund? Yes. So now there's a lot of them, because they are not dying. Their life span is really pushing to that level. So unlike today, where in Zambia we are talking about I don't know. Last time I was hearing it's about 35.
Wow.
Lifespan. So meaning that we have got very few old people who are actually clocking to 90s, clocking to 80s. They are very, very few. Most of them, they are ending with 50s.
And that's really sad.
60s. So 3/4, but if we have 18 to 20, or even you get to Mutumbi there, got even to cemetery, any cemetery. You check on the FIPAM papaya, you are going to see that it's written 22 years, 18 years, 15 years. So why are we dying like chicken like that? Then something has to be wrong. Yes, there's something wrong, and we need to address this matter very seriously. We need to take it very seriously.
Definitely.
Yes.
So I'm really excited with the fact that you have brought that out, because we have seen how people have been dying lately.
Yes.
And it's very alarming and very concerning, because you find that what we hear people say is, I
am a sudden death.
Yes, sudden death. Suddenly someone falls, we do not know. And this is why I think, coming back to defining what health is, last time we were asking, is health does it just mean it's the absence of infirmity, of sickness?
Yeah.
And so some of us feel, I remember the last time I had malaria personally.
Yes.
Because malaria at some point became one of the
leading disease, of course,
causes
Zambia.
of death.
Yes.
And so when we feel malaria, we feel like, oh, I'm healthy. Just because I'm not feeling sick, just because I'm not having any pain in my body, I'm not going to the hospital, it doesn't mean that I'm not sick. So coming down to what you're saying, Doc, I think we need to really get this information out and make sure that we see how to recondition our lives, because some of the leading causes of death, or some of the ailments that people are having, are things that, as you said last time, can easily be reversed.
Very simple. Very simple.
What we're lacking is knowledge.
Every disease is reversible. Every disease.
Every disease.
Yes. It's just a matter of what system are you applying. Okay?
Even
how are you
cancer,
conditioning your body?
Even cancer.
What is cancer? Cancer, we are talking about, the fermented cell. A cell which has stopped using oxygen.
Wow.
The cell which is now in anaerobic condition, where it is not using oxygen anymore. So why can't I furnish the system with high levels of oxygen?
Well, you make it sound very simple, Doc.
Yes, to starve the cancerous cells which are actually getting out of control.
That is very...
So I need to starve. So how do I starve? So those are some of the things which we are saying that, we need really to go deeper, to understand, the mechanism of the human system, and also how we can be able to reverse some of these illnesses we are talking about.
I really cannot wait for us to get into some of those details, because already I want to ask you so much about what you have just said.
Oh, yeah.
But we'll keep it for another time.
Okay.
That is why you have to tune in. You have to subscribe, hit that bell, hit that subscribe button, subscribe to this channel. This is Victoria's Health Diaries, and you're listening to Dr. Hamalilo. He is a bank of wisdom. You have heard for yourself what you have heard so far. And of course, if you don't want to miss out on anything that you have heard this far, make sure you tune in and subscribe, share. Let somebody else also have what we are sharing right on this platform. Doc, we've had interactions even before now, and I know what I've personally been inspired by your lifestyle and what you have built so far, and the kind of influence you have managed to have, not just in our country, but even beyond borders, like what you're just from sharing. some of the achievements you've made in the medical field. And it's really impressive, I must say. It's really encouraging. And I really can't wait for us to get to share all of this that I have gotten so far. You talked about the ionized water, and I'm sure we'll be talking about that soon, because we would like to, as we understand that we have a problem.
Yes.
We have a health crisis.
Very, very big
And so
problem.
us understanding is not enough. Us knowing that we have a problem is not enough. We'll need to get to a point where we offer solutions, and they're going to be logical, they're going to be practical, and I can't wait for you to hear that. So that is why, you know, we would try to make sure we get the word out so that people do not remain in the dark or ignorant about their health. So, Doc, you mentioned affiliating with the Balm of Gilead. What is that about?
Well, it is a health center, of course, which is registered in the country of Zambia, under PACRA, and is doing a lot of activities. Balm of Gilead is an institution, of course, which we are saying affiliated through Zambia Natural Medicine and Research, in conjunction now with the Ministry of Health. So you can see the chain.
Yes, of course.
So it's a collective, efforts. So these can play this role, this can play this role. So it's not only leaving to the government alone to say, okay, they are going to battle it out, because we know when we are talking about means of health, they will be able to build us clinics and hospitals and what. That's the role of the nation or the government.
Of course.
No. Now with us, we said, okay, we cannot for sure be full-time maybe into that other system. Why can't we also move it in this way? Because this part, the government is not doing it.
Of course, that's supplementing what the government is doing, exactly.
So it's not doing. To us, is much on the information. So meaning that on the giving the information, first thing on the how to teach people, so that they'll be able to learn how to live well, and then be able to resist diseases. That's how it goes.
As we say, prevention is better than
prevention.
cure.
The language which has been there all along is better than cure.
Of course.
So you cannot wait, because what we have discovered and see is that people, they don't get sick in the hospital. So somehow we are saying that, when it's like, you know, the last time was, I was giving a story when I was on another platform. I was giving a story of a certain man who was going along the banks of the river, along the banks of the river. And all of a sudden, this man, he sees ichitumbi cha mwana chireserauka pameshi. Ichitumbi, meaning that a dead body. A dead body of a child. You know, he got somehow shocked. He says, but why ichitumbi? So he goes, to retrieve. Okay? Achifumya mumenshi, muri river, achivika palia. All of a sudden, he sees another body coming. Ichitumbi, meaning that a dead body. Nachimbi chochire sereuka. Put ascender foot. At the end again, then FI shiratambate, okay, narabika nomba, kananka nivalanda, tinarabika kakampu.
Akafitumbi.
Kako afirisha nomba okura abude fitumbi, kufuma mumenshi. I want the listeners to get this story. Seriously.
Sure.
Ero apanga nika kampu palapeni. Alefumia fitumbi. Alefumia fitumbi. Uyo na turike fitumbi fyabana. Bale sango kuti atina abafa pameshi. Ale turika. And there were these other people who were moving also. Maybe they were having a stroll. Ilewalanda tika nature walk. Basango umuntu alife pami piri ananga ya fitumbi fyabana. He says, but why are you killing these children? I said, no. I'm doing a charitable work. What charitable work are you doing here? No, nde fumia fitumbi pameshi paliva pa kaina chisanga fyogutra tifire salauka nomba. He says, I think you are not thinking, man. You are not thinking. Because how can you be kula fumia fitumbi ero nomba taure mona gutrati inga source source ukule fumama problems ani kwisa now you wikerere fyo kula fumye fitumbi until they picked this man. He says no, the real charitable work real charitable work
I get it.
Kuya ku source kanse fyo bale basango uterati kwali ba epu where these children bale yangalira pameshi bale samba so all of a sudden kalenga kaya chapwa nishina kaya kufo kunomba kai takaishi wokusamba the currents at a certain point there is so high and then yamusenda nishi afa kabiri.
Wow.
So now what we are trying to say to put this point Victoria West that you know prevention okuishiba source okulefumina pari problem is very important. And this I give a very simple example of what is happening to say that where do people get sick?
Yeah.
Where do people get sick? They get sick where? Kumayanda.
Kumayanda, mkoi.
Now, from Kumayanda, what do we do?
To
Ambulance.
hospital.
Ambulance. Where? But they are going hospital. Ku hospital kuli na abondapa. At discharge. But they were not futu kuli we. Ukuli ubwafi. Nomba kai ichirere ngo gutati barerwa databeshire. You have seen the problem.
Yes.
The so-called intervention measures. Nikwisa nomba nyuko ku hospital. Where are you going to go? You are going to go into the consultant room. Wamona ba doctor. Ba doctor ebe utabeshibe epo olala. Ba doctor tabeshibe nengande yo olala. Ba doctor abobene tabeshibe nefya kuli efyo olele. You have seen where we are messing up.
Yes.
Now, I'm not saying that it's bad, it's wrong to build a hospital. No, what we are saying is that we should do a corrective to balance up, optimize the balance.
Sure.
Now, how do we balance up? Meaning that we should also be training these people how to live well so that they'll be able to resist amarwere. Then there will be no transfer case of taking amarwere to the hospital. If at all, maybe the complications that we should be finding there, maybe if you have accidents, not we are talking about none, or maybe we are talking about degenerative diseases. Now, if you are talking about degenerative diseases, Victoria, we are saying these are non-communicable diseases like arthritis, asthma,
heart problems,
problem which is cardio whatever vascular disorder, heart problems, heart failures, kidney failure, liver cirrhosis. Okay, where we are talking about problems here with gases, because now these gases in the stomach today, quite ni
normal.
It's normal. Diabetes, when we talk about diabetes, whether in the village or in the town, they are all affected with this so-called sugar disease.
Exactly. And it wasn't so before now.
Let's talk about mental. It's out of control now.
We have
so now,
that.
Why are we having this? Kumayanda. Problems. So now, as a balm of Gilead, okay, we have got the higher institutions, which we call the bigger hospitals, of course, where we are referring cases. So as we are saying that, okay, why can't we start working from this point, which is the basic?
Okay.
Yes, from the ground, from the grassroots. So meaning that from the grassroots, we are going around to train, to teach people. You should know what to eat. You should know how to eat. Even just how to eat. But who abantu nabafwa muri ashiria irine how to eat. But tabeshi just chewing, chewing. Twalikwata ama varieties ya fyakulya. Ama liquid, ama solid, ama shan. How do you chew thoroughly well ama foods in the solid state?
Kwa wepo nefe doctor.
Yangu tatai.
I know some people that just chew quickly. To a certain extent. So kumina fe fast.
Ala apopadidia shi yagutirati tureranda ema basics. So we don't need, if at all, I would even say ingakwali area imo where we should spend a lot of money. Instead of spending a lot of money to be ordering the drugs from India, from China, from Egypt, we spend a lot of money of teaching people how to live well.
I'm interested in how to eat,
Hey, what to eat, how to eat, and when to eat. Very, very, very crucial. Very, very important. Nomba, if your favorite to alifi sura. Nomba, mulandu wauta to alifi sura. Do you know what has happened? Now it has caused ilyatule randati a heavy impact. Could you ailments in the country? Even today, nga mwayafye mumwine muma hospitals where you see ama line ulu chero bila mwalika muma clinics, you think that the whole entire company na here ku hospital. Chinkupiti cha muntu. Ninshi ati no ama files from one appointment to another appointment. From one appointment to another, no come. So at the end of the day, because of also the ratio, doctor to patient ratio. Naye nayo yachita shani yaleta akantu nomba, because these people, they are overwhelmed.
Of course.
They cannot handle the influx of people who are getting to the hospital. They can't. It's not something easier. Where you are talking about this person all of a sudden you change. That's why sometimes doctors they become confused. Yes.
And we forget that they're also human.
Yeah. Complain. Society. Doctors medical poison. Some of these things is because of a stressous condition. They are actually hit too much to this stress. Stressous condition.
I can't wait to get into those conversations as well.
So you'll find that this is a very wide thing where we are talking about basics, which we have overlooked as a nation, and we have overlooked as a medical systems, or in the medical realm. So to us, we are only waiting. A patient comes and then we prescribe. That's not enough. Because uyu muntu epo atampire kulia kunuma kulia ngari chinchintiwe, meaning that nga mwalimu chita prevent from there. Because these are some of simple things where we are talking about. Okay, what is your problem? He says no headache throughout. Headache throughout, because the headache is everywhere. Umutwe ukukalipate obulwere, then something is wrong. And the 3/4 need dehydration. 3/4 yama headaches ayamule umfati yo headache umutwe na unshupa onanika ni onangumumala ni problem ya dehydration.
But you know, Doc, from there are a lot of people that struggle with headaches, and then they say ni nwa menshi ni nwa. So when you say dehydration, and maybe they have a way in which they drink water, but they don't seem to find
topics are we would love to see that the people that are glued to this wonder program not be following up because we want really to review secrets are simple but very, very, very important. Yes, very simple but very important. Because in Atwalanda, utonutuma nanga tulenda tutudionko. Tulenda tutuma drop. Just little drops. Because when we're talking about the dehydration, immediately, it's very simple.
We'll allow that for another time, Doc, so that somebody gets to subscribe and follow, so that when you get to explain that, they're going to get the whole chunk and not just kadionko. This is Victoria's Health Diaries, and we're super glad you're glued to this network. Make sure you subscribe and like and get to share about it, so that we make sure we're making the right impact in the right way. So Dr. Hamalilo has been elaborating so much on what you have heard this far, and we look forward to having our next conversations, building on from where we started the previous episode, this episode, and the coming episodes. But we'll need you to keep yourself subscribed to this channel and to keep you glued to this very channel. So we're glad you have joined us, and we're grateful that you have subscribed so far. So get to share that word, get to help somebody, help another person, help the other person. It's going to be a chain, and we look forward to having a better Zambia, and of course seeing some statistics. And we have seen the number of people that have been dying of late. We have seen how alarming, how scary those numbers could be, and we do not want to keep having this kind of situation in our country and beyond. We want to make sure that our loved ones, our friends, our sisters, our children are healthy and live much longer and fuller lives. So make sure that you keep yourselves subscribed to this channel, that you follow all our airings, and we'll be glad you did so.
Catch Victoria's Health Diaries every Sunday at 19 hours.